Peters here with OMNE Chiropractic. We are diving into the whiteboard again. I want to break down a bigger piece of content. So this is like cornerstone content, and then within the description I will link to the other videos. So I want to kind of tie everything together related to posterior thigh pain or hamstring pain, whether it's pain, numbness and tingling, or limited mobility. So that could be due to a number of different reasons that I'm going to try to simplify with this chart, and then within that I'll provide different links to other videos that I've done to give you the solutions to try to fix the different issues. So if we look at posterior thigh symptoms, and that's very broad, right? It could be pain, it could be numbness and tingling, it could be limited mobility. And then we go to a test, and this is just one test. We would never just do one test in the clinic. We do a lot of different tests. We spend a lot of time in assessment so we can be very clear what we're dealing with and spend less time in treatment. But if we just look at this SLR, which stands for straight leg raise, the ability to lie on your back and bring your leg up gives us a ton of information, and then based off of that and your response to that, it kind of puts us into two different categories specifically. So the first one on top here is muscular. So if it's straight muscular, I have a previous video called the Quadrant of Doom. This is to assess different types of hamstring injuries and your risk to get a hamstring injury based on whether your hamstrings are short, weak, or both. So then we kind of, from the muscular, if you want to watch the Quadrant of Doom video, we have short. These are going to respond to stretch techniques. We have a different video for that. It's called a better hamstring stretch, where you kind of stretch it in a standing position rather than forward folding. If it's weak, then that's what we need to do is loading. So I'm going to drop a video here soon about loading your hamstrings with a bunch of different exercises, whether it's a hamstring bridge, a Nordic exercise if you have access to that, and then both. So sometimes it's not necessarily clear-cut muscular weakness versus shortness, so sometimes we have to do both, and we can use eccentric exercise as well as different stretch techniques. So that's the muscular track up there. Then we kind of have this neural track, and I must say, like, it's not always one or the other, but we're looking for the dominant mechanism, the one that we're going to attack first and with the most time and energy to see how the symptoms improve. So we always trace it back to the beginning. But if we have a neural issue, first and foremost, we're going to go to lumbar spine. So a lot of hamstring or posterior thigh symptoms, whether it's pain, numbness, tingling, or limited mobility, could be from the lumbar spine. So I put that on top for a reason. I have a video called Fix Your Lumbar Spine, and it kind of goes through a bunch of McKenzie exercises to rule out or screen your lumbar spine to make sure that your leg pain isn't actually coming from your back, which is very, very common. So if we kind of rule out the lumbar spine, the next place we go is the hip. There's a bunch, we look at piriformis or the deep gluteal syndrome. We're saying that the symptoms in your hamstring or your leg are actually coming from your hip. So I have a video on how to stretch out your piriformis and some hip mobility stuff to target that posterior hip to get that tissue a little bit more supple so the nerve is not irritated. And then we kind of have this catch-all term, sciatica. So any symptoms down the back of the leg, we can further classify that based off of somatic referred or whether it's truly radicular. So don't focus too much on the sciatica. That is just a term that gets a lot around. We have a bunch of different exercises on our YouTube channel for sciatica-like symptoms, but I felt like this whiteboard session would be healthy for both patients and clinicians to understand, like, this is the thought process that we kind of use here. We're trying to match the right patients with the right treatments, and we're not going to waste our time stretching something that needs loaded. So if you have any questions, please drop them down in the comments. Please like and subscribe our page. I will try to do my best in the description to really break this down and link all the videos to the different solutions that we have over here. So thanks so much for following along. Dr. Peters with OMNE Chiropractic.